So the following three speakers bring to you their personal experience and views from the patient side. Our first speaker, Nancy Scott, was on dialysis for 7 years and received a kidney transplant in 2011. She is currently president of the Dialysis Patient Citizens, a nonprofit organization located in Washington, D.C., which is dedicated and committed to improving the quality of life for renal patients through advocacy and education. She is also president of the board of directors at Henrietta Johnson Medical Center in Wilmington. Nancy continues to advocate on Capitol Hill and speaks at symposiums and conferences. So first up, Nancy Scott.
Good morning, everybody. I hope you've had a chance to look at my bio. I'm not going to go through all of that. I got initials after my name, but that's not important. The important thing is that I am a patient. I will briefly tell you my story, and I speak everywhere, but this is coming home, and I'm nervous. I'm looking at Dr. Dressler, my first nephrologist, and I gave him such a fit. He left the practice. I got Joanne Smith out here, my nurse manager of my facility, and she used to have gray hair when I left, but as you can see, she doesn't anymore. And of course, Dr. Swanson spoke. He was one of my transplant surgeons along with Dr. Scantlebury. And I also have in the back the chief executive officer of the organization that I'm with, Dialysis Patient Citizens. I just see so many people, and we just thank you so much for coming. Let me tell you briefly what happened to me. I have been a diabetic for 23 years, and I controlled it through diet. Well, about 12 years ago, I went to see my primary care physician because I was feeling sluggish. And I said, I must be gaining weight. I was gaining weight, but I said I shouldn't feel this sluggish. So I went to him. He said, Nancy, go home. You do too much. Just take it easy for a couple of days. Well, for about a week, I laid on my couch. That was my comfort zone. And I never even sit in the living room, but that's my comfort zone when I don't feel good. So I had to go out for an appointment. And when I came back to find my car, I could not see my car in the parking lot. Everything was white. So I did put on some sunglasses, and I was able to make it home. That's scary enough. So that Friday, I felt even worse. By Saturday morning, I was in the emergency room because I couldn't stand up, and they took me to the emergency room. So I was examined by the attending physician right here at Christiana Hospital, and he kept saying, do you have kidney disease? I said, if you ask me that one more time, because I'm a nurse, I got defiant, I was in denial. That Monday morning, I was a full-fledged dialysis patient. They came the night before, put a catheter in my groin, and by that morning, I was on dialysis. Did I like it? No. Was I afraid? Yes, because I had no education. And I no longer became a medical person. I became a scared, frightened patient. So when you get education, education is empowerment. So, okay, I was a scared patient for a long time. I was a chaplain here at the hospital, so I was able to dialyze here for quite a while. I accepted the fact that I had dialysis and that I would have to go for dialysis 3 times a week. I had, like I said, I had no education, so I was still very afraid. So I went to find out what options I had, and I did. I was given options. I could go on home hemodialysis, I could go in-center, or I could get a transplant. So my daughter went with me, and when I found out that I could get a transplant, my daughter said, oh, fine, I'll give you a kidney. My daughter and I are very, very close, and I did not want her to give me her kidney. Well, as it turns out, she could not, because when I went for my mammogram, for my testing, I had breast cancer. So I was on radiation, chemomedicine, and dialysis at the same time. Fortunately, I still have the breast, and 5 years ago, I was transplanted. So, so I mainly want to tell you that dialysis does not mean the end of your life. As you can see, I went on, I became an advocate. I got involved with Dialysis Patient Citizen, which helped to save my life. I had a healthcare team, but patients have to remember that you're the number one person on your team. You have to know your numbers. I even cannulated myself. I put my own needles in. I told Joanne, you know, I got infiltrated once, and that meant that my arm was black and blue from the elbow to the wrist. I said, Joanne, I'm going to put my own needles in. I said, if anybody infiltrates me, it will be me. And from then on for 7 years, and I had to wait that long because in Delaware, when you have cancer, you have to wait 3 years. So I was on the list for 7 years. I did get a cadaver. I got a phone call one day, and I knew that that was my kidney. And I had never packed a bag before. I'd been called once before, but on that particular day, I got ready because that was my kidney. And I went in that night, and then the next morning I got my transplant. And I remember waking up and seeing a whole bunch of people in my room, and I was so clear and so coherent that they were saying, well, when is she going for her surgery? And I had already had it. So I have had a very successful story, and I do realize that transplantation is not a cure. It's just another remedy. But I'm here today to tell you, for those that medically know, my creatinine is 1.0. Dr. Swanson and his team keep a close eye on me, and when I'm messing up, they call me up because they know I'm so busy doing stuff, but I do take care of myself. And I just want you to know that please get educated. If you have high blood pressure or diabetes, take care of it, please, because education, as I said, is empowerment. As I said, I have a very successful story, but that's because I take care of myself, not just because I'm a nurse, but because I know that I want to stay on the planet as long as I can. Thank you very much.